Let's now look at a story that has raised concern all over the country. The government is moving to tighten Ebola screening measures at major entry points as the World Health Organization named Kenya among the countries at a high risk of Ebola transmission.
The Minister of Health says it is setting aside 530 million Kenya shillings for prevention measures. KTN's Yanofula has been following that developing story.
6 months since the Ebola virus began spreading in West Africa, there has been a total of 1,013 deaths. This out of the 1,848 cases. The cases have been reported in Sierra Leone, Liberia, Nigeria, and Guinea. Back home, the Ministry of Health acknowledges the rapid rate of transmission amongst the affected countries and is speeding up prevention measures as Kenya receives more than 76 flights from the affected countries weekly.
The screening now has been enhanced. We already have now today approved that we shall get 30 additional health workers tomorrow morning. As you know, we have a separate gate of entry at the airport for all passengers coming from West Africa. And this is not just for Kenya Airways.
The World Health Organization has categorized Kenya as a second-level high-risk infection country for the Ebola virus. The first category comprises of the 4 countries already affected in West Africa. Second category lists those at high risk of transmission, while all other unaffected countries fall in the third category.
Kenya is not currently affected by the outbreak of Ebola since it has not confirmed any case. In this regard, it is clarified that due to the air connectivity and geographical proximity countries currently having Ebola outbreak, most of the African countries, if not all the African countries, could be classified as category 2.
But what we've done is to put a contingency plan which will be managed on a multi-agency basis by my ministry, Ministry of Transport, Ministry of Interior, Kenya Airways, Kenya Airports Authority, to make sure that if, God forbid, we had one case of Ebola, then it will be dealt with very, very, very swiftly.
Temporary holding rooms at Jomo Kenyatta International Airport for suspected cases have been established, while isolation facilities have been identified at Kenyatta National Hospital and the Mbagathi District Hospital. Ebola virus is transmitted by direct contact of body fluids or secretions such as blood, urine, sweat or saliva with a 10% survival rate. With the World Health Organization citing Kenya as a high-risk area for the transmission of the Ebola virus, the Kenyatta National Hospital said their isolation ward is fully equipped and ready to receive patients of the Ebola virus or those suspected to contain the virus. Ian Wafula, KTN, Nairobi.